Good morning everyone. Presenting a paper on comparison of psychosocial and emotional impact of childhood strabismus in a parent versus patient. We know that strabismus affects any child in two ways, functionally resulting in amblyopia, psychosocially causing various emotional and psychiatric upheavals in the child. Despite so many impacts, yet there is a delayed diagnosis and the treatment noted in Indian subcontinent and has been published also. This has been attributed to knowledge, attitude and practice difference between the parents and the patients having strabismus. In this study, we compared this perceptual difference between the parents and the patients and evaluated what were the various barriers in the parents which resulted in delayed treatment and diagnosis. Was a prospective comparative study including 191 patients with strabismus and their parents. Any other coexisting pathology or poor comprehension of the questionnaire became an exclusion criteria. We studied patients and parents of all the strabismus which presented to us in the and we subjected them to pediatric adaptation of adult strabismus 20 questionnaire. The first 10 questions, as been shown in the 10 red color, has been assessing the psychosocial impact of the strabismus on the child. The 11th to 20th question has been assessing the functional impact of the strabismus on the child, and both these were modified to for both child as well as for the parents. They answered in the form of yes or no, followed by which a statistical analysis by using a Mann-Whitney test or independent t-test was done. Nearly 47% were in the range of 10 to 13 years, and exotropia was the most common type of strabismus in our results. Most of the children were from semi-urban background. So when we compared the psychosocial subscale of between the parents and the patients, we noted nearly 97% of the children did say us that there is a psychosocial impact of the strabismus in their life, but only 50% of the parents agreed to this aspect of the strabismus. This one question was the only point where both parents and the patient said yes, and if we go back and see, that is the 7th question, is the squint causing a cosmetic stigma? So this shows that the parents just perceive the squint as a cosmetic stigma in the child. The other emotional and the psychosocial aspects were neglected. But in contrast, when we assess the functional subscale, we noted that both parents and patients accepted, yes, squint causes a functional abnormality. It does affect my child's reading writing skills, the exam performance of my child, and my child is going back in the playtime because of the squint. Despite this agreement, what are the various barriers what the patients face? It is either belief related, where the parents believe that this is a good luck charm. 34% of the parents said. The rest of the parents said this, it's just a cross eye. How is it going to affect my child? Or I can get it treated when my child becomes 18 years of age. The more the educated parents, there were misinformation because of the social media in 23% of individuals, where they believe that surgery can cause damage to the child's eye or repeat surgeries may be needed to treat the strabismus. So there are multiple studies in 2002, 2003 which says that there is a deficiency of knowledge, attitude and practice among the parents towards the children with strabismus. This study has been done 20 years down the lane. Has anything changed? Yes. 76% of the parents now have a knowledge that squint does affect the functional impact of the child, and there is a management aspect which is available in various institutions. But still, there is a huge gap in the perception of the psychosocial aspect of the strabismus between the parents and the child. Child says yes, parent says no. Coming to the management, the social media is now playing a major role. In the rural background, the beliefs are still a major barrier for seeking strabismus treatment, resulting in intractable amblyopia. The prevalence of strabismus in India is about 7.4 for 1,000. So we need to definitely bridge this gap between the patients and the parents' perception of the strabismus. There is a need for awareness programs, changing the myths of the parents, and a perfect counseling when any child or the parent presents to our OPD, so that we can prevent this blindness of an amblyopia which we result because of the unmanagement of the strabismus. These are my references. Thank you.
Questionnaires are you prepared?
No, ma'am. This is a modified the adult AS questionnaire which has been used by Hart in 2009, and now that has been used as a WHO quality of life assessment questionnaire for any child which has been suffering from the strabismus to assess the avoidable blindness in them.
Your age group is?
6 to 16 years. We did try in 5 years, 4, but then the parents started to put a bias on the child. Hey, idu illa, this is no, this is yes. So the child got biased by the parents' input. So we thought we will take those children who don't need the parents' help to fill up this questionnaire, and that came somewhere around 6 to 16 years of age.
Thank you.
Thank you, ma'am. Thank you, sir.